So how far mapping when it comes to classical descriptions, you talk about the four groups, you talk about the Cavana superiority and inferiority, you talk about the superior and inferior in the Cavana science. So that is actually functional in the Cavana area. So you can actually see the thing is intact and using a cutting brush, so I told you. So the principles of drilling, you have to drill slowly. So this is what I was telling you, you have to use the polishing curve. So you cannot actually control with the cutting curve. Okay. So I can open up the bone here there. So you have to be really careful with your drilling. The other option is to use a punch. So dig the bone and then subsequently use the punch. Okay. So you will have to expose the carotid in quite a few cases. That is drilling around the cella.
So when you're using punch, you have to enter actually.
Which one?
When you're using punch,
so when you use punch, the principle is you have to dig the bone and subsequently use the punch. Dig the bone, make an opening and then break it. You can't directly enter with the punch. So you see the pattern of drilling when you come along the cavernous region, you have to drill in a C-shaped manner. Like you see that in the carotid. Okay? So you have to drill along the contour of the exactly. So that is actually the area of the cavernous carotid. This one. Okay? So we have taken that bone there. And this is what you have that is going below the cella. So simultaneously, the instrument of the drill actually needs to get feed. Okay. Side of the bone is actually using the whole principle is exchange and then subsequently you can place the slab. Okay. So I think we have got it there. We can have the elevator.
In the cellar, you can use an elevator or a rectangle or an angle probe or probe to fracture the bone.
So once it's thinned out, what you can do is you can gently elevate this bone. So again, what we use is there is still more that can go off here, so you can see this. So you can get far lateral also. I will show you. I don't want to spoil the specimen in the cutting work. So that is why I can just take gently here. So the advantage of cutting work is not, it is technically very difficult to damage these structures. Okay. Polishing, what happens is it will just bend it. So this is how you engage your hairstyle. So dig out the bone and subsequently push the dura away and then you take a bite or you use outfracts of the bone. Okay? Is that clear? Now how safe is to take this? Remember, this has its disadvantages, especially when you go laterally. Especially when you go laterally, do not engage the punch and blindly bite it. At some point you feel resistance, don't push it further.
Sir, if dura ruptures, what can you do in this? It will collapse, right?
Dura?
Rupture, it will collapse, right?
Dura will not burst. Now there are simulations. Now this is actually normal anatomy. Now you can have simulations where the tumor itself will protrude out. Okay, sometimes you have tumor inside the sphenoid sinus. funds. So I can go till the point where my funds engage. Can you see that? So once it stops, once I can't engage my funds any further, I will probably stop it at that point. Okay. So just the tip has to be used to show this. So the advantage of this kind of exposure is that you have all your carotid, you have your optical, everything in view. So you know what is there. So can you see that now? So again, correlate, you come back, you see that the carotid is far lateral. Can you see that?
Yeah, that's correct.
So I can take out more bone there. In fact, I will make drill them more and we can take out faster.
So what we are seeing is the view of the hypophysis, isn't it?
Yes. So when you open up the cellar, what do you see? You see when you open up the cellar bone, what we are seeing is basically the pituitary gland. This is actually an interdural structure. In the sense it lies between two layers of the dura. Okay, I'm taking out this bone here also. Okay. This fracture here. Yeah, so you can see the carotid also there. And normally you don't have to expose the carotid. Now there is actually the carotid there. Okay. Can you see that?
Yes.
There is the carotid.
Yes.
Okay. So we keep it distillate time. Okay. Can you appreciate the carotid there?
Yes.
Yeah. So this is for demonstration. Again, I rarely use the punches. So can you appreciate this fusion as it goes laterally? How the dura blends with that layer of the carotid. Can you appreciate that?
Yes.
How
This
this
is the non-blue structure.
so that will be the cavernous sinus.
Cavernous.
Okay. So the carotid is actually, can you appreciate the carotid now? So there is a carotid here. And you can see this is the layer of the dura. So remember, the cellar will expose it, so I am almost down to the floor here. Now the cellar, when you expose it, you have two layers of dura. What are these layers? The first is the so you have a meningeal layer and an endosteal layer. So immediately we get the bone. When you take out this bone, but when the bone is taken out, what you see first is the endosteal layer. Subsequently, you have the dural layer. Okay. So this is the exposure. So I will show you the anatomy of the carotid, how the carotid moves down. So this is actually the optical. You can see the area of the optical carotid basis here. The optic now, there is a carotid going around it. Is that clear?
Yes.
Okay.
Suppose if there is a supracellular extension of the pituitary, is this exposure enough?
So again, your exposure of pituitary. Now this is from purely fats. When you have a tumor that is confined to your cellular unit, this is what you have to do. Now, as the tumor goes up, so you have different variations. You can have tumor going up into the supracellular unit, you can have tumor going up laterally, depending on where your exposure will be. Okay? So, are you all happy with what we have seen so far? Okay. At this point, now regarding what sir asked, now if you have a supracellular